Personal Nursing Philosophy and Orem's Theory. Introduction. I am pursuing a degree in primary care family nurse practitioner at Purdue University Global, with about 2 years of experience as a registered nurse, where I am on the exceptional track toward achieving that goal. In addition, being virtuously liable and accountable for one's convictions and behavior is essential to the nurse's role as a normative framework because it is at the heart of what it means to be a nurse. Despite the apparent disconnect between nursing theoretical and practical aspects, it is abundantly clear that theory-driven clinical work is at the heart of the nursing profession. The topic of this paper is going to be the influence that Dorothea Orem's self-care practice model has had on the nursing profession. Personal Nursing Philosophy. My approach to nursing is centered on compassion and assisting others, particularly in situations in which patients are unable to look after themselves. My beliefs are consistent with Orem's thesis because it recognizes the human connection that exists between nurses and the patients who require assistance. My worldview, like that of a lot of other people, incorporates the concept of do no harm as it relates to all individuals. Because assisting man in his moment of need is the primary focus of Orem's thesis, this perspective of the world is congruent with mine. As a nurse, one of my primary responsibilities is to facilitate a patient's return to their previous state. Orem's theory lays the groundwork for investigating fundamental problems in nursing and possesses enormous potential for investigation. It is useful in responding to queries that family-registered nurses are frequently asked. Orem includes in her hypothesis effective nursing strategies that can be used to accomplish the goals of her theory. The nursing interventions that encompass guiding, directing, providing cognitive counseling, and teaching the patient are as follows. In my role as a primary care practitioner, I will acquire the skills and knowledge necessary to carry out the necessary actions to ensure favorable results for my patients. Dorothea Orem's self-care practice theory. The act of aiding other people in the provision and administration of self-care to maintain or improve human functioning is at the core of Dorothea Orem's self-care philosophy. In a nutshell, she regarded nurses as the connecting link between man and the demands of self-care during difficult circumstances. Her approach provides a framework for nurses to follow when assisting patients with self-care activities, regardless of the nature of the patient's conditions. The goals of the theory are to assist patients in meeting their self-care demands and to keep them in a healthy state. Orem's theory applied to family nursing practitioners. Family nurse practitioners can provide care for their patients using the nursing process that is outlined in Orem's theory. During the initial step of the process, known as assessment, data is gathered to establish which patient problems need to be resolved. The formulation of a treatment strategy is part of the diagnostic process, which comes next. The very last stage of the process is known as implementation, and it is during this stage that the healthcare team puts the plan into action. After all of these processes have been finished, an analysis of the procedure to assess its level of success is carried out. Self-care practice theory and research. The effect of Orem's self-care model on fatigue in patients with multiple sclerosis is the subject of a research study with the same name. One of the various approaches that can be taken to manage the problems of chronic conditions is to give people more agency. Patients diagnosed with multiple sclerosis are now more likely to possess the knowledge and abilities necessary for self-care and empowerment as a result of the long-term adverse effects of the disease. According to the findings of the study, Orem's self-care approach is considerably successful in lowering the weariness experienced by people living with multiple sclerosis and help to empower them as individuals. Another investigation was conducted by Valizadeh et al. To determine the impact that Orem's self-care concept has on the clinical performance of nursing students and the degree of patient contentment. Students and caregivers alike can develop stronger caring skills, clinical reasoning, and a deeper understanding of their patients' issues when they improve their communication abilities and cultivate effective partnerships. A nurse can deliver superior care when they have a depth sense of their patients. According to the findings of the study, the productivity of the intervention groups was much greater than that of the comparison group. Nursing consultation applied to hypertensive patients is the last research case that is based on Orem's self-care hypothesis. The importance of support and education efforts for patients diagnosed with hypertension and how nurses may assist in making lifestyle modifications was emphasized throughout this research. Through observation of the client's routines, it was possible to establish a connection between the client's health needs and their lack of capacity for self-care. To satisfy the expectations of self-care, it is essential to maintain follow-up meetings and discussions that encourage lifestyle adjustments. Orem's theory conceptual framework. It is possible for a novice practitioner as well as an experienced clinician to implement Orem's self-care theory, which is one of the key strengths of this body of work. The relationship between self-care, the expectations placed on self-care, the self-care agency, and the nursing agency is depicted graphically below. The nursing agency is a complicated organization comprised of educated people who have been trained as nurses. These people are able to act, know, and assist others in meeting the requirements for self-care. The nursing system is the result of a chain of interactions that have taken place between nurses and patients. When a patient's requirements for self-care are greater than the self-care agency, this nurse self-care system is triggered. Because of this procedure, there will be a demand for caregivers and care. Conclusion. It is necessary to make outstanding nursing care judgments to achieve success as a primary care provider. To fulfill the objectives of preventive medicine, health management, and disease control, nursing interventions need to place a strong emphasis on complete evaluation and care coordination, crisis intervention, and client instruction. In addition to this, advanced practice nurses are required to have at least a fundamental understanding of several fields, such as public health, bioinformatics, and development studies. Nurses need to acknowledge the connection between evidence-based practice and ideas like Orem's and to place primary emphasis on this connection. To narrow the gap, advanced practice nurses need to conduct ongoing studies.